Hello, I'm Angela Birch, an underwriter at ProAssurance. I wanted to talk with you about the importance of one-to-one supervision. This type of care is provided to patients who are at risk of causing harm to themselves or others. It may be appropriate to initiate this close observation of patients with cognitive impairment in order to prevent falls or for those who are actively suicidal. If left unsupervised, they are at risk of harm. The use of this service should be based on the risk assessment of the patient's physical and mental state at the time of the assessment. All patients should receive care in a safe setting and have protection for their emotional health as well as their physical safety. The expectation of effective monitoring is to provide each patient with an optimal level of care, ensuring sensitive supervision of the patient's physical and psychological well-being. Directly observing the patient, sometimes referred to as arm's length observation without any barrier, provides the least restrictive approach. Continuous monitoring, so the patient is always in view, could also provide an opportunity to foster positive therapeutic relationships. For patients who are confused, having someone close by may reduce their agitation. Through this close monitoring, staff members can quickly identify changes in the patient's condition and facilitate a rapid and appropriate response. Consider these risk reduction strategies regarding one-to-one supervision. Develop standardized protocols for one-to-one observation, including assessing the patient's emotional state at regular intervals, reporting changes and concerns to the healthcare team, and of course, documentation. Ensure that appropriately trained staff members are available to provide continuous one-to-one observation for at-risk patients, particularly during periods of heightened threat or crisis. Identify patients at high risk of suicide through a thorough risk assessment. Establish criteria for when one-to-one observation is needed. Conduct a comprehensive environment of risk assessment. Modify the physical environment to reduce risk, including removing or securing items that could be used for self-harm. Implement a strict medication monitoring protocol, including regular assessments of medication side effects and effectiveness. Continuously monitor the need for one-to-one observation and adjust the level of supervision based on the changes in patients' conditions and risk factors.